everyone, I'm Lucienne Spencer. I'm a postdoctoral researcher here at the University of Birmingham, and I'm going to be talking about testimonial injustice and loneliness in late-stage dementia. So psychiatrist Frieda von Reichmann is well known in the literature on loneliness as the first to consider loneliness as a psychiatric condition. In the opening of her essay entitled Loneliness, von Reichmann describes the following encounter with a nonverbal woman. Perhaps my interest began with the young catatonic woman who broke through a period of completely blocked communication and obvious anxiety by responding when I asked her a question about her feeling miserable. She raised her hand with her thumb lifted, the other four fingers bent down towards her palm so that I could only see the thumb, isolated from four hidden fingers. I interpreted the signal with "that lonely" in a sympathetic tone of voice. At this, her facial expression loosened up as though in great relief and gratitude, and her fingers opened. Then she began to tell me about herself by means of her fingers, and she asked me by gestures to respond in kind. We continued with this finger conversation for 1 or 2 weeks, and as we did so, her anxious tension began to decrease, and she began to break through her non-communicative isolation, and subsequently she emerged altogether from her loneliness. Nonverbal expression is a vital, though often overlooked form of communication, particularly for people who are neurodiverse. Dependency upon nonverbal expression is commonplace in people with intellectual disabilities, some forms of autism, and late-stage dementia. In this instance, von Reichmann instigates a meaningful interaction with the young woman and recognizes the communicative value in her non-verbal gestures. Through this social interaction, von Reichmann, in her own words, broke through her non-communicative isolation, and subsequently she emerged altogether from her loneliness. However, not everyone is as sensitive and receptive to nonverbal communication as von Reichmann. Through this talk, I'm going to explore cases where such nonverbal communication is not recognized as being meaningful due to implicit prejudices attached to the nonverbal person. Drawing on the epistemic injustice literature, I call this injustice nonverbal testimonial injustice. Cut off from rich social interactions, I'm going to argue that nonverbal testimonial injustice leaves such nonverbal people particularly vulnerable to loneliness. Okay, so what is testimonial injustice? Testimonial injustice is a term coined by Miranda Fricker. Broadly, testimonial injustice occurs when a person's testimony is ignored or not taken seriously due to implicit prejudices attached to that person's identity. For example, if you were to ignore Mary's presentation on quantum mechanics in virtue of the fact that she's a woman, because you hold an implicit belief that women can't do quantum mechanics, that would qualify as a kind of testimonial injustice. However, the process behind testimonial injustice is a little bit more complicated. According to Fricker, we register a speaker's testimony through a faculty of testimonial sensibility, a kind of social perception or like a radar that allows the hearer to register certain people as being reliable and someone from whom you can attain information. In the words of Fricker, when somebody registers as a reliable informant, then we see them as being epistemically charged. Identifying reliable and trustworthy informants serves our basic human urge to pool information and gain knowledge from our environment. However, persuasive prejudicial attitudes tends to throw this perceptual faculty off kilter. Due to socially instituted prejudices, people who belong to certain marginalized groups might fail to register as being epistemically charged or as being reliable within the hearer's testimonial sensibility. In this instance, the marginalized speaker is then vulnerable to testimonial injustice. So in the case of Mary I gave, Mary does not register as a reliable informant within our testimonial sensibility, so her testimony about quantum mechanics is then not taken seriously. The literature has thus far confined the concept of testimonial injustice to acts of telling. I propose that it's time to broaden the horizons of testimonial injustice to include a wider range of expressions. And controversially, the form of communication I have in mind here is nonverbal communication. Okay, so consider the following example. You're sitting on a busy commuter train, and at the next stop, another person boards the train. As the train starts to move, they stumble slightly, unsteady on their feet. Their face shifts from an expression of frustration to one of concern as they notice a sea of heads filling almost every seat. At this point, you stand up, and rather than shouting across the noisy train, you simply gesture towards your seat and smile at the man. Their face shifts to an expression of relief, and they nod politely and they shuffle towards the now vacant seat. In this commonplace scenario, a meaningful communication has taken place without one word being uttered. You don't need the person to say out loud, "I am frustrated, I'm concerned, I'm looking for a seat," in order to infer what their gestures mean. And this is because nonverbal communication is an essential aspect of our interpersonal relationships. In fact, an estimated 60 to 65% of our communication is nonverbal. Therefore, much like the act of telling, gesture is a form of meaningful communication. In line with Fricker, I argue that the person on the train is perceived to be epistemically charged by the onlooker. In such scenarios, testimonial sensibility seems too narrow. As a perceptual faculty that allows us to view people in epistemic colour, I propose that the term should be revised to communicative sensibility, with the understanding that information and knowledge can be communicated through both verbal and non-verbal expression. So in what situations can this communicative sensibility be said to fail? One potentially amoral way in which this communicative sensibility can fail is through our encounters with non-human animals. Imagine witnessing two elephants in a zoo seemingly doing nothing of note. They're making the typical behaviour and movements you'd expect an elephant to make. However, unbeknownst to you, their subtle movements are communicative gestures to one another. Through ear waves, trunk dragging, tossing of the head or strutting, one elephant may signal to the other that they are ready to mate, that they want to play, or that there's been a death in the herd. But the gestures of the elephant are meaningless movements to the untrained eye. In this sense, the elephant does not register in our communicative sensibility as being epistemically charged. As a differently bodied animal, it encounters the world in a way that is alien to us. Therefore, the entirely distinct meaning structure of their species goes unrecognized by our communicative sensibility. In contrast, elephant experts might have trained their communicative sensibility to register such gestures as being meaningful. So for the elephant expert, these gestures might say, "I am bored, I'm ready to mate, I'm sad," and so on. However, through an untrained communicative sensibility, these gestures say nothing. In what follows, I explore a case in which a communicative act is missed by our untrained communicative sensibility in a distinctly immoral way. In this case, the communicative act is not missed because the communicator is of an entirely different species. Although a fellow embodied human being, their communicative act is not registered as being epistemically charged because they belong to a stigmatized group. I argue that this constitutes a case of non-verbal testimonial injustice. The example of non-verbal testimonial injustice I'm going to be putting forward here in this talk is that which is inflicted upon people with language-inhibiting dementia. The umbrella term dementia captures a form of major neurocognitive disorder that leads to a decline in neuronormative cognitive functioning. This includes difficulties with information processing, language skills, and memory. Some common forms of dementia include Alzheimer's disease, vascular dementia, dementia with Lewy bodies, frontotemporal dementia, and mixed dementia. According to the World Alzheimer's Report in 2018, around 50 million people live with dementia worldwide. Despite these numbers, people with dementia often suffer credibility-deflating identity prejudices attached to both ageist attitudes, because the risk of dementia rises steeply with age, and the stigma attached to the illness itself, or what Ian James Cook would refer to as pathophobic prejudices. People with dementia are often wrongly perceived to be stupid or childlike, crazy, not all there, and not themselves anymore. Such identity prejudice suggests that people with dementia are incapable of purposeful and meaningful communication and the pursuit of life-enhancing relationships and activities. Loss of language is a common feature of dementia. Patients with dementia demonstrate, among other signs, word-finding problems, sentence comprehension deficits, and a lack of cohesion in discourse. At later stages of dementia, patients may lose the capacity for verbal expression altogether. For people with language-inhibiting dementia, non-verbal communication is essential. Non-verbal expression may take the form of art therapies like drawing, painting, drama, and music. However, the most common form of communication for non-verbal dementia patients is through touch, body language, hand gesture, and facial expression. People with language-inhibiting dementia can communicate that they are in pain by pointing to the area of the body causing them pain or wincing. They can communicate if they want or they don't want something by pointing, pulling towards, pushing away. Disagreement and agreement through nodding, shaking their head, shrugging their shoulders, or dismissive flick of the wrist. And in general, emotion through laughing, sighing, tutting, eyebrow raising, smiling, frowning, winking, blowing kisses, clapping hands, and hand squeezing. Unfortunately, due to implicit societal prejudices that portray people with dementia as being, as I said before, childlike, stupid, or in a vegetative state, our communicative sensibility frequently fails to register such expressions as being meaningful. Instead of recognizing people with dementia, their non-verbal expressions as a form of communication, our communicative sensibility often disregards such gestures as meaningless behavioral patterns from someone who lacks the cognitive capacity for communication. By virtue of the prejudice attached to their identity, they may not appear as being epistemically charged. Consequently, their gestures are frequently ignored. I suggest that in this instance, we ought to call this a form of non-verbal testimonial injustice. So for the purpose of this talk, I provided the following examples from CQC, Quality Care Commission reports, and recent research in order to demonstrate the ways in which people with non-verbal dementia seem to lie outside the scope of communicative sensibility and are vulnerable to non-verbal testimonial injustice. The exclusion of non-verbal residents from communicative sensibility can be observed through the institutions in which they reside, and we're going to be focusing on care homes. So we observe people, here's some quotes from these reports. We observe people who could fully communicate were provided with choices by staff. However, non-verbal residents were not provided with choices. The registered manager confirmed some people required pictorial aids to communicate and understand information, but these had not been sourced for staff to use. Another quote, some rooms had little decor or pictures and no information to assist in getting to know the person. Other rooms, however, were warm and cozy and personalised. We found that the rooms with little or no personal effects belonged to people in the later stages of dementia. This suggested that people with high needs or in the later stages of dementia did not have their dignity maintained in the same way as people who were able to make choices and advocate their own needs. One person who stayed in their room was described by a member of staff as having closed down. We found their room was the furthest away from the lounge and the person was not provided with any method of summoning help. The research also showed that non-verbal residents were more likely to be interacted with in a merely task-focused manner without communication. They are sitting and feeding a person, and while they're feeding him or her, they've been talking to somebody else. And I have seen situations where one of the carers just mechanically puts something in the resident's mouth. It's terrible. I've also seen other examples where they talk to a relative over the resident's head. Another quote, we saw two staff go into one room, put the light on and start getting a non-verbal resident up by removing their duvet without allowing the person to wake up, asking for their consent or how they were. When such late-stage dementia residents are excluded from the scope of communicative sensibility, their nonverbal communications are more likely to be ignored. Here's some more examples. We, the inspectors, observed how a staff member wiped a person's face after eating. They did not ask the person or offer them the opportunity to wipe their own mouth, but instead bent forward and wiped their face. The person was visibly startled by this and pulled away, showing that they did not enjoy the experience. A similar reaction was observed with a second person, but the staff member did not appear to notice people's discomfort. One person was holding their head and scrunching their eyes closed, indicating that they had a headache. Although a member of staff had just completed the medication round in the lounge area, the person's pain had not been identified. The resident had been gesturing towards her lower body over a period of several days. It had nonetheless taken staff even longer to establish she had been in physical pain. So I think there are several harms produced by such nonverbal testimonial injustice. However, the harm I want to focus on here is that of loneliness. Loneliness has been defined as the exceedingly unpleasant and driving experience connected with an inadequate discharge of the need for human intimacy. There's been ever-growing research into the link between dementia and loneliness. Several studies have demonstrated that higher levels of loneliness increases one's risk of low cognitive functioning and rapid cognitive decline over time, thus increasing their risk of dementia. Further studies have demonstrated that 1/3 of people with dementia report feelings of loneliness. These same studies then found that loneliness in dementia is likely to be a product of depressive symptoms and increased social isolation. Therefore, there seems to be a kind of looping effect in dementia, whereby loneliness is both a risk factor for dementia and is a likely outcome of dementia due to internal factors of the illness itself, like the aforementioned depressive symptoms, and due to external factors like that of social isolation. In order to better understand the full extent of the harm in the case I've explored in this talk, nonverbal people with dementia, I suggest that we can turn to Jill Stauffer's concept of ethical loneliness. When someone falls outside the realm of communicative sensibility, they are subjected to what Jill Stauffer calls ethical loneliness, a condition undergone by persons who have been unjustly treated and dehumanized by human beings and political structures, who emerge from that injustice only to find that the surrounding world will not listen to or cannot properly hear their testimony on their own terms. So ethical loneliness is the experience of having been abandoned by humanity, compounded by the experience of not being heard. Drawing on Levinas, Stauffer observes that selves and worlds are built by human interaction. Those forces are the backdrop to the worlds we build and in which we reside. Because our sense of self and the meaning of the world is so essentially intertwined with human interaction, those who are, in her words, abandoned by humanity are met with what she refers to as a kind of existential solitude. According to Stauffer, such persons are abandoned by humanity inasmuch as they go unheard, their voice has no weight, and they are excluded from social interaction. This abandonment then leads to a kind of deep-seated ethical loneliness. Stauffer, like Fricker, limits her scope to just speaking subjects going unheard. I hope that this talk has demonstrated that non-verbal communication is an important and meaningful form of communication that ought to be included in our understanding of the kinds of communications that can go unheard, or in this instance, unseen. As such, I argue that non-verbal people are unduly subjected to the kind of social abandonment identified by Stauffer that then leads to ethical loneliness. In order to combat such ethical loneliness, Stauffer concludes by asking, how might those of us who care to listen learn to hear better? To answer that question in the case of nonverbal testimonial injustice, I'm going to turn back to the quote we started with from Reichman. Reichman clearly has a well-trained communicative sensibility, which has registered the patient as being epistemically charged from the offset, allowing her to recognize the catatonic patient's hand gestures as meaningful and allowing her to mediate rich social interactions that eventually alleviated her feelings of loneliness. I argue that our communicative sensibilities require a kind of gestalt switch in order to register the nonverbal gestures that people with language inhibiting dementia and other nonverbal people as the meaningful communications they are. Thus, I conclude this talk by suggesting that in order to combat the ethical loneliness nonverbal people are frequently subjected to, we need to better train our communicative sensibilities to be more receptive to nonverbal communication from marginalised groups and to reflect upon the implicit prejudices that may be throwing our communicative sensibilities off kilter. Thank you.